Well, good morning, everyone. Welcome to this morning's webinar. My name is Bernard, and with Insurance Advisors Direct, and pleased to have you with us this morning. Just to give you a Aetna refresher. So before we get started, just a couple of items we need to take care of. Currently, everyone on the webinar is muted, but you're more than welcome to type in your questions, and we'll get to those after the presentation. Also, this webinar is being recorded, and it'll be on our YouTube page within about 48, 72 hours, and we'll make sure everyone gets a copy of that as well. So my contact information is on the screen as you see it in front of you, and I'll be following up with you after the presentation. So without further ado, we're going to get this started. We have Dan Dombrowski. He is Aetna's broker manager for Michigan. So everyone, welcome Dan.
Moving forward, and we are going to talk about a little bit of the highlights for the Medicare Advantage plans at Aetna. And I just want to start off by saying we are actually the only 4.5-star Medicare plan in the state of Michigan. I think a lot of the other carriers are either 3.5 or 4 stars. So I know we are the only 4.5-star carrier, and that's based on member service, member experience, and quality of care delivered. So that's something we're very proud of. We also have a borderless, seamless, nationwide PPO network where your clients can access doctors and hospitals in-network nationwide. So with the Aetna plan, when you pull out that ID card, no matter where you are in this country, you have nationwide brand recognition. We have the over-the-counter benefits that's available through CVS, and we also have worldwide coverage for emergencies and urgent care situations. And another thing I want to mention is we are a broker-only sales force. We do not have any captive agents. And the only reason I mention this is because we are not competing against you in any way. We are here to partner with you. And I know during open enrollment, probably almost every day, I know situations can occur where your client may try to get a hold of you, or they just don't know any better and they call the carrier and they get transferred to the sales department and get signed up over the phone, and you could lose a client that way. I know that does happen every day during AEP, and then you have an issue there as far as getting that client assigned back to you, if that can even be done. So, just again, we are broker only. We do not have that captive sales team here at Aetna to compete with you. And then I also want to talk about the no copay stacking benefits. So as you know, with Advantage plans, you get a service done, you pay a copay. Those can certainly start to add up on you over time, or even for a single doctor visit where multiple things may be done. So with that, now you pay a maximum of 1 copay per provider per day, regardless of the number of services that are rendered. This applies to observation stays in the hospital and also specialist or primary care doctor visits. So here's an example of a situation if you were to go to a specialist so you went to your heart doctor, you have to copay to see the doctor. While you're there, they're going to do probably some lab work, maybe a chest x-ray, diagnostic. You could potentially have 3, 4, or 5 or more copays for one single office visit to a doctor. And that can get very expensive. So with the Aetna plan, again, we stack those copays when we adjudicate the claim. We stack them from highest to lowest. Your client is just going to simply pay the highest copay, and then all of the other copays are waived by Aetna. This is going to significantly reduce your out-of-pocket costs when you use the insurance when you go to the doctor. So again, 1 copay maximum per day per provider, which is our no copay stacking benefit. And this also applies to if you were to go to the hospital. Let's say your client has chest pains. They go to the emergency room. Well, they're not admitted to the hospital. They're under observation. So when you're under observation, any services, diagnostics, testing that are done could add up on you in terms of your out-of-pocket costs. So again, during the observation stay, 1 copay maximum per day which is going to significantly reduce your out-of-pocket cost. So applies to observation stays. This is a screen print right from the evidence of coverage showing you. You'll see halfway down the page where it says plan services include copays only, the highest single copay for all services received. And this is right out of the EOC that your client will get when they sign up for the plan. So that is the copay stack, and then I did mention nationwide borderless seamless network. This network nationwide also includes the Cleveland Clinic, which is ranked number 2 in the nation by U.S. News. So this delivers a little extra value, a little extra peace of mind, knowing that your clients can access a world-class facility such as the Cleveland Clinic, if they so choose, in network. And I actually had a meeting like this in Grand Rapids last AEP, and a broker in the room said, Dan, I remembered this when you talked about Cleveland Clinic. I had a client who had a medical condition that had been going on for about a year. Had seen a few different doctors. Nobody could figure out what was going on with this guy, and so he remembered the Cleveland Clinic. The guy ended up going there. Within 4 hours, this gentleman had a diagnosis for his medical condition that he had been trying for an entire year to get. And so I think it just goes to show if you have a client that just wants a second opinion, you know, they have access to this world-class facility that's really not that far from here. So again, pointing that out, it also ranks number 1 nationwide in heart surgery and cardiology and urology, in the top 10 for all of these other specialty areas. So again, a lot of value when you look at the access to not only doctors and hospitals across the country in network with the brand recognition of Aetna, but also the Cleveland Clinic is there. So to take it a step further, what does this mean, this nationwide network? Because how does this benefit you? How does it benefit your clients? I would be willing to guess that most of you on the call today have clients who are snowbirds. This can fit a really nice niche of people who are snowbirds, especially we live in Michigan. People like to go south in the wintertime. This plan travels with you. Nationwide brand recognition. If you also have clients that just simply like to travel, maybe they go on vacation, this is a great option. This is a good plan for them because, again, it's going to provide them with the nationwide borderless network, accessing in-network doctors and hospitals. Okay, so this is our service area for 2020. This is our expansion. The areas you'll see in green are the new counties that were added January 1st, 2020. Total of 32 counties, so it's a very large area. Now, I just want to be clear. If you have a client that resides in any one of these counties, they can buy the Aetna Medicare Advantage plan, but they can access in-network doctors and hospitals nationwide. Okay, and I want to point out, though, for those of you in the eastern part of the state, we do now have a contract with Henry Ford Health System that was as of last July, and so we're pretty excited about that. But I also want to just say this. With the Aetna PPO plans here, these are passive PPO products. So what that means is that your client can go to any doctor, period, regardless of whether they're in or out of network. Even though we have about 90% of doctors contracted in Michigan and about 85% of them contracted nationwide, they can go to any provider, period, with a flat, fixed dollar, predictable copay. But if they happen to go to an Aetna doctor that's in the network, they're just going to have a lower copay. So it's really that simple. And I'll show you what I mean. I'm going to skip ahead a few slides here, so bear with me. On this screen here, you will see, for example, on the left-hand side, okay, you'll see the first 3 columns in purple the HMO in column 1. So if you go out in the HMO network, you're not covered out of network if you have that plan. But again, on the PPO plans, you have copays for out-of-network primary care physician, specialist, podiatry, other healthcare professionals, labs, hearing, eye exam, all of these services that you see in the left column, the far left in gray, flat dollar, fixed, predictable copays if you go out-of-network. So if you're in Grand Rapids, we don't have Spectrum Health, but you can still go to a Spectrum Health doctor with a flat dollar, fixed, predictable copay. Okay, so I'm going to just move forward from there. And this is just a little chart last year showing the year-over-year Medicare Advantage growth. Aetna was number 1 going into AEP with over 30% nation, and this is not just Michigan, so this is nationwide growth, followed by Anthem, Blue Cross, Humana, Cigna, and then United Healthcare coming in at number 5 at 8%. So we were the top growth carrier as of last year at this time, so I wanted to mention that too in the slides. A few different highlights here. We'll just go through, and these products do work very similar across the state. We have 4 different regions in Michigan, and the benefits do vary slightly between region, but the essential, the coverage and how they work in terms of the embedded benefits are very similar. So I'm going to just run through the Southeast Michigan area plans. All of the medical plans we have a $0 medical deductible and a $0 PCP copay. You'll see here on the inpatient, $295 for the inpatient copay, $4,800 max out of pocket, which is very competitive for a $0 plan. I know Priority Health had a really good 0 plan. I believe it was the Edge plan, but their inpatient copay I think was $350 a day, and their max out of pocket is $5,300. So this is a richer plan, and then when you look at the embedded benefits here, I mean, our dental allowance, you are going to be hard-pressed to find a better dental benefit that's embedded in a Medicare Advantage plan, because you're not limited on the Aetna plan to, say, 2 cleanings, 2 x-rays, and 2 exams. This dental allowance covers any dental service from any dental provider. So there is no network. You can go to any dental provider, period, and it virtually covers any dental service. The only exclusion is teeth whitening. But aside from that, you can use this money for crowns, bridges, dentures, implants, you name it. It's a reimbursement, so they would pay up front at the dental provider and then get reimbursed back from Aetna for the full amount within 30 to 40 days. The eyewear allowance, same thing. Any licensed eyewear provider, it's a $100 allowance. Submit the bill to Aetna, and you're going to get reimbursement back in the mail within 30 to 40 days for the eyewear allowance. If you do go to an iMed provider, they do the reimbursement at the point of sale. So if your glasses, let's say, are $150, on this plan you got a $100 allowance, they would take the $100 right off at the point of sale. You'd pay the $50 and walk out the door. So you have the over-the-counter benefit at $50 per quarter through CVS. So virtually any over-the-counter medications and vitamins, supplements. There's about a 42-page booklet that has a multitude of items that are covered. A quick question here I see from insurance advisors. We do agent of record changes on these plans. All you have to do, you can type the letter on behalf of your client for the agent of record change. Just have them sign it and then email that letter to brokersupport@aetna.com, or you can send it to Bernard and he can send it to me and we'll get it processed for you. But that email address is brokersupport@aetna.com. We do allow AOR changes. You also get the Silver Sneakers benefit, which again, about 10,000 fitness centers nationwide. If you have a client who is diabetic, one nice thing about Aetna is that we're going to purchase a new glucose monitor for them. It's a $400 value, manufactured by Johnson & Johnson, and any test strips that they need on a monthly basis, 100% coverage by Aetna, zero cost to the member. You just have to use our preferred vendor, which is LifeScan, but it is zero cost for all your diabetic supplies. We even have a meal program if you're hospitalized, even for one day. When you return home, we are going to mail you 14 meals, and that's free of charge. There's 4 menu options to pick from. There's lobster tail, filet mignon. That's actually a joke, but there are 4 menu options. There's kosher, Latin, vegetarian, and pantry that you pick from. I mean, they're not going to be the best meals in the world, but they are free of charge, and a lot of people really appreciate them, especially coming home from the hospital when they're trying to recover. They maybe not be able to go grocery shopping, and it's a great benefit. The biggest complaint that we've heard is that they don't have enough freezer space for all of the food. So we're thinking about maybe including a freezer, free freezer when you buy the plan for next year. So I'm just kidding on that too. So we have all of these things embedded, plus again the copay stacking, where you're just paying a maximum of 1 copay per day per provider. And don't forget, and I saw a question on this. This applies to observation stay at the hospital if you're under observation. So you're not admitted to the hospital, you're under observation. Any services that are rendered, diagnostics, testing, during that observation stay, the copay stacking applies. So you're going to pay a maximum of 1 copay per day if you're hospitalized under observation. So hopefully that answered the question. If not, feel free to unmute, and I'm happy you can explain what you're looking to, any clarification. I'm happy to provide that on that. So you have all of this, the borderless nationwide network with nationwide brand recognition, roughly $2,000 in benefits on a $0 plan. So that is the zero PPO. Then we have the Premier plan. This is a $32 plan. Very similar, except it's just a little bit richer in benefits. So the cost sharing on the member side is lower. So you'll see $260 for the inpatient copay instead of $295. Labs and X-rays are lower, and then a $4,500 max out of pocket instead of $4,800. But then your embedded benefits are also richer. So you're getting $750 in dental instead of $525, $250 in eyewear instead of $100 in eyewear, and then this one also has a hearing allowance. Okay, so you have hearing allowance, and that's a $1,000 hearing allowance. Over the counter is even higher at $75 a quarter instead of $50 a quarter. But all of the other benefits are the same: silver sneakers, the diabetic supplies, and so forth. So that is the $32 plan. And then this is a new plan we brought out for January 1, 2020. This is an HMO. But I gotta mention, this is a PPO lookalike. So it is very similar. It works the same as a PPO in the respect that it has a nationwide borderless seamless network. In fact, it's the same network as the PPO, no difference. It's an open access plan. So that means that there's no referrals required and there's no PCP requirement. So you might be sitting there thinking, well, Dan, what's the difference then between this plan and your zero PPO? Well, the difference is, number one, that this is a richer plan if you look at the benefits. But number two, the key difference here is that this plan does not have out-of-network coverage. So do you remember when I said on the PPOs, if you go out of network, you have a flat dollar, fixed, predictable copay? Well, on this plan, if you go out of network, you're not covered. So that is a big difference. Your clients, you have to be extra careful on this plan that you do not go out of network. But again, we have about 90% of doctors in Michigan that are contracted across the board. Nationwide, we have 85% of doctors contracted. And again, this plan and the PPO plan have the same identical network, not only in Michigan, but nationwide. You have nationwide, borderless, seamless, in-network coverage for in-network hospitals and doctors. So this is the HMO plan, and you'll just see and I'm not going to read every line again, but the benefits are just richer, lower inpatient copay, lower max out of pocket, and then your embedded benefits are just a little bit better, a little bit higher. You get 28 meals on this plan instead of 14. You have the hearing allowance. The dental's a lot more at $775 versus the $525 on the $0 plan. Okay, so moving forward, I just want to show anyone in West Michigan, this is a listing of all of the in-network hospitals in West Michigan. We have a very robust network there, even though we don't have Priority Health, we don't have Spectrum. We have a lot of other great facilities. We have Mercy, we have Metro. If you sell in Muskegon or anywhere along Lake Michigan, the West Shore, we have a lot of, in fact, one of our top brokers in the state is from Muskegon. So those folks along the West Shore, those areas are far enough out of Spectrum where it doesn't affect them. So this is really a great plan for those. And then you'll see at the bottom the out-of-network hospitals that we currently have. And we're still, even though it says fall of 2009, fall of 2019, I should say, Bronson, we're still in discussions with them, hoping that will happen in the next couple of months. Okay, I'm going to just skip through some of this we did cover. I do want to, again, I have to point this out. I want to spend another minute here because you will be hard-pressed to find a better embedded dental benefit in an MA plan. This allowance, guys, any dental provider, any dental service, no waiting periods. And you can use this dental allowance in conjunction with a dental insurance plan. So you can double dip essentially, and if they wanted more dental coverage, then buy the dental rider for say $20-$30 a month. Use this to pay your whatever that doesn't cover, and that's perfectly fine. Aetna, we don't care. So that's a great thing. If they think they need more than say the $500, $600, $700 in reimbursements, that's another option available to them. Okay, so moving forward, I'm going to, some of this we did already discuss, and I'm going to get this to the slide here where we talk about the provider search tool. So looking up your in-network doctors and hospitals, very, very simple. AetnaMedicare.com is the website you'll see here, and then you click Find Provider. Very intuitive, and I do want to just say, though, if you happen to, we have 90% of the doctors contracted. If you are looking for a doctor and they're just not coming up, this doc find is not perfect. It's not 100%, and I don't think any company has a doc find that's 100%. But what we can do is you can send us an email, and we will verify in the master database if the doctor is in fact in network, because I will say 8 out of 10 times when we check the doctor against the database that's not showing up in DocFind, 8 out of 10 times, lo and behold, that doctor is in the network. So we're working on fixing any issues. We had a few glitches. We're getting better at it. So let us know if you can't find a doctor, and we will certainly double check that for you. Okay, a few highlights on the pharmacy. We have two levels essentially of pharmacy, preferred and standard. If you go to a preferred pharmacy, you pay a lower copay. At the bottom of this screen, you'll see the 5 preferred pharmacies for 2019, which are the same for 2020: CVS, Costco, Kroger, Meijer, Walmart. The home delivery is also considered preferred. You get the lower pricing on that as well. Okay. A few slides comparing against the Medicare supplements. I'm going to just move through those. And then I do want to mention this too, because we have the online application, which is called Ascend, is the system we use. So you can submit a paper app or online. But if you submit an online application with Aetna, we have a really nice thing because you can earn a $50 per application bonus as long as you use Ascend online and enter them online through our value-based enrollment, which is essentially just a button you click at the end of the application. Don't leave money on the table. You can earn an extra $50 per application. It's actually called an admin fee. We can't technically call it a bonus, but $50 per application for clicking a button. And all that button is, at the end of the application, it says, would you like to participate in a value-based enrollment? And all this is a way for Aetna to connect a wellness advocate to your client to help them onboard and to say, hey, they're going to receive a phone call that says, welcome to Aetna, and they're basically going to help them to schedule their annual wellness visit if they need help with that. They can set health goals. They can do a multitude of things, get them lined up with a care management program or a disease manager if they happen to have the need for that. So it's a win-win across the board. You can make up to $50. There's 3 buttons at the end of the application. When you submit the app, it says, thank you for applying to Aetna. Here is your confirmation number. Always write down the confirmation number for your records. Below that, it's going to say, would you like to participate in a value-based enrollment? You have 3 options. You can click on Connect Me Now, schedule a callback, or decline. If you can just let your clients know that, hey, when you sign up for Aetna, you're going to get a call from a wellness advocate. This has no implication on your enrollment. You're not going to be declined. You're not going to get a rate up. All this simply is a wellness advocate who is going to reach out to them as an extra layer of service and value that you're now providing to your client that they maybe did not have before. So it's a win-win across the board. You get the $50 enrollment fee. They get now a wellness advocate that's going to help them on board, answer any additional questions that they might have, set health goals, schedule the annual physical. If they haven't done so yet, they can help them look up doctors. They can help them look up drugs. They can help them align with the case management program. So this is a win-win across the board. Don't leave money on the table. We had a guy last year who, just this past AEP, this agent earned over $10,000 just in the value-based enrollment. That, again, don't leave money on the table. You could use that money for a vacation. You could use that money towards marketing or buying additional leads to sell more business. You could use that money however you want. But just my point here is use Ascend and earn that extra service fee. Don't leave money on the table. So that is a really nice feature that we have. I'm going to just move forward here. I want to mention we do offer the senior supplemental plans at Aetna, which includes the Medigap. So those are available, very competitive rates. We don't have the best rate for the turning 65 individuals. I will say they're not the lowest, but if you have anyone that's around 67 to 72, maybe 75, that's kind of our niche in terms of the pricing. So our niche, again, age 67 to 72, 73, up to about 75, very, very competitive on the rate. Okay, we also have the add-ons, so the hospital indemnity goes really nicely with the Med Advantage program, covers that inpatient hospital copay, cancer, heart attack, stroke. We have the dental, vision, hearing rider. A lot of those are being sold now for folks that want a little bit extra coverage and want to have, one company, that they're dealing with instead of 2 or 3 different carriers for these ancillaries. So that I don't handle those, but if you want to get contracting on those, contact Bernard. He'd be happy to get you aligned and get you going forward down the tracks on those plans. So next steps from here is certification. There's 2 parts, AHIP and then our online Aetna product core certification. We only accept AHIP. I want to mention that because some people, they take Pinpoint or they use Gorman. We unfortunately do not accept either of those. We only accept AHIP. in step one, this is the website for the certification online. It's very simple to do. If I can complete it, I think anybody can do it. And that's the website for that. And then the market training is a requirement, which this is what we're doing today. So I have the listing here of the attendees, so you will get credit for the market training that we're taking place today. And then contracting, step three. Just simply get with Bernard. He will help you with the contracting step by step and get you up and running if you're not yet done so. And then you'll get a ready to sell notice from Aetna that says you're ready to sell. You can order your enrollment package, your materials and supplies. You can request access to Ascend, which again is that online application. Okay. On the commissions, we do pay the CMS maximum allowable commission, which did go up to $510 for new enrollments, and then renewals at $255, plus the value-based enrollment, which is the wellness advocate that will connect to your client once enrolled, up to $50 per application, and that's per app paid out weekly. These are not paid out with the regular commission, so you get this money up front. You don't have to wait for this. There's a weekly check run that goes out. Okay, so just a little bit on the member support. Any client issues you have, we encourage them to call member services. This is the phone number. Okay, and you can actually do a three-way call with the client if there's any issue that needs resolution. And that's the phone number there in bullet point number one. And then broker support, of course, you have Bernard, you have myself. We have Lynn Peterman. You'll see her information. She is an extension of broker services dedicated solely to Michigan. And her information, and she's phenomenal. Her information is listed at the bottom of the screen, her phone number and email. So I encourage you to seek assistance from Lynn with anything you might need as far as ordering supplies, ready to sell, status, contracting, certification, licensing, any of those things can go through her, and she's more than happy. We're here to help you sell. Okay, so that kind of wraps up the portion of the slideshow. I did see a message pop up on Ascend. How do you request access to Ascend? That is very simple. All you're going to want to do is go to Producer World, which is the Aetna portal. And I think we have I'll go back here, bear with me. So here you'll see Producer World. And on the right-hand side, this is the website where you can log in or register an account. Once you log in there, you're going to click at the top of the screen, Individual Medicare. And then from there, once you're in there, you're going to see a tab that's called Tools. And after you click that, you'll see where it says Ascend Virtual Sales Office. You click there, and it's going to say Request Access. There's a button. Click that, and you're going to put in your email address, your information, and you simply click Submit, and it will. That's how you request access to Ascend. If you need any help with that, happy to help you through that, but that's where you go to do that. Okay, so again, that kind of wraps up the portion that I had, and I'm going to just kind of put this back out there to say, hey, are there any other questions that maybe I could address further on the call? And I wanted to get any feedback from you on the line as far as what you guys think about the plans and what we discussed, and if you have clients that could benefit from any of these products that we have here to offer for MedAdvantage.
Well, Dan, I have a question for you. With the coronavirus hysteria going on, is Aetna doing anything special with their Medicare Advantage plans for the seniors?
Yeah, so that is a great question, and we just received some communications this morning that said that they're putting together some talking points and some frequently asked questions around that as far as what services are available. So that is going to be sent out in a broker communication. I'm thinking probably today or tomorrow. So stay tuned and keep a lookout in your email. The broker communications team is putting together distribution on that with some of the details. That's been approved by compliance. So please stay tuned for that. But great question.
Good. Thank you. All right, folks. Are there any other questions for Dan while we got him on the line? All right, well, looks like we don't have any other questions. Dan, is there any other things that you would like to discuss or just popped up? Yeah.
That was all I had. So, special thanks to you, Bernard, for getting this arranged and set up, and I appreciate that and glad to be a part of it. So thank you, and thank you to everyone else on the call for being here today. And anything else that we can do to help you sell, just please let us know. We appreciate the opportunity to earn your business.
Oh, great, Dan. Thank you. I mean, you are a big help. Aetna, to me, has one of the best PPLs out there for our seniors, and Dan is a very valuable resource to IAD as well as to you guys. So yeah, we're gonna bug Dan to death because I know we're gonna have all type of questions, especially when AEP rolls around. So no, let's get Aetna rolling for our folks. So I will be reaching out to each and every one of you about Aetna, see if you have any questions, getting you contracted, or how we can increase your enrollments. Do like to mention next week we are having our top 14 sales ideas, so you will be receiving information for that. And also, just to let you know that IAD, because I am the life and annuity specialist, so we will actually have expanded our life and annuities product line, which actually means more great opportunities for you guys. So I'll be reaching out to you on that as well. But, want everyone to have a great weekend and get out there and make sure you wash your hands. And again, Dan, thank you very much, my friend.
Hey, thank you as well. Everyone have a great weekend.
All right. Take care, folks. Bye.